Hello everyone, welcome to another episode of Let's Talk. Neonatal care is a common concern among parents-to-be. We shall get to know more about it today. We have with us Dr. Jacob, Specialist, Neonatology and Pediatrics, Aster Hospital, Qatar. Doctor, welcome to the show.
Thank you, Meena.
So doctor, babies under what age can be called a neonate?
Yeah. To start with, babies up to 28 days of life, we call it as a newborn. And any babies who require medical support are taken into the neonatal intensive care unit. That's called as NICU.
Doctor, what types of medical condition in a baby requires NICU care and attention?
Definitely, it can be categorized into two types depending upon the mother as well as the baby's condition. Regarding the mother, the most common thing which we encounter is jaundice for the newborn. It happens due to Rh incompatibility of the mother. The mother is O negative. Then these babies are more prone for jaundice and they need phototherapy. The second thing we notice is babies born to diabetic mothers who are insulin dependent. These babies go into hypoglycemia and need intravenous fluids. The third is the maternal conditions. If there is placenta previa or abruptio placenta, these babies need admission to NICU. And lastly, it would be pregnancy induced hypertension in the mother. Then coming this in brief about the mother's conditions. Regarding the baby, we divide into system wise. If it's respiratory, in term babies, the most common thing that we find is transient tachypnea. It's called as transient tachypnea of the newborn. As the term implies, transient tachypnea, there will be only a increased respiratory rate only for a transient period, maybe 5-6 hours, and which gradually subsides. Some babies, this tachypnea might go on for 5-6 hours, and these babies need continuous positive airway pressure. It's called CPAP. Next we find is in premature babies is respiratory distress syndrome, where there is a surfactant deficiency. So surfactant has to be administered and then the baby has to be connected to the ventilator or bubble CPAP, as I have mentioned before. Then we encounter is babies with meconium aspiration. This happens in utero. Baby passes meconium because of hypoxia. It could be due to cord around the neck. And coming to cardiac causes, it could be congenital heart diseases, and again the congenital heart disease is divided into cyanotic and acyanotic, and depending upon the baby's condition, we take into the NICU. Then comes the central nervous system causes. These some babies do have seizures. Seizures can happen because of intrauterine hypoxia. Hypoxia could be due to the cord around the neck, and also seizures can happen because of metabolic conditions like hypoglycemia, as I mentioned before, hypoglycemia, hypocalcemia. All these metabolic conditions can precipitate seizures. And the very rarely found is hydrocephalus and neural tube defects like myelomeningocele and meningocele. So these are the conditions that we do take the baby into NICU for monitoring.
Doctor, who takes care of a baby in an NICU?
Definitely the nursing staff takes care of the baby in the NICU. In level 4 and level 3, it's 1-to-1 ratio. That is the single nurse takes care of a single baby. Whereas in level 2, the single nurse might take care of 2 babies. And not but the least, as doctors, we do advise and guide them regarding further treatment of the newborn.
Doctor, talking about the levels, what are the levels of care that can be provided in an NICU?
In NICU, we have 4 levels of care. That level 4, level 3, 2 and 1. In level 4 NICU, we have all the critical babies like cardiac babies who have done cardiac anomalies or malformations. And coming to level 3, we admit premature babies who need surfactant and ventilator support and the CPAP, bubble CPAP. In level 2 would be the babies who are stepped down from the weaned off from the ventilator, and babies who are fed on tube feeds, pallida feeds, and also term babies we admit in level 2 nursery for phototherapy. Level 4 nursery would be babies just for observation. If from the postnatal ward, if there is problem with the baby, just for observation we keep the baby in level 1 nursery.
Doctor, can a mother stay with her baby in an NICU?
Definitely mother can be with the baby in NICU. As I mentioned, in level 4 and 3, the parents can come in and see the baby after proper hand washing. In level 2, as I mentioned, as baby is weaned off from the ventilator, the mothers are taught how to feed the baby, like it would be premature babies. So, initially we start with the tube feeds and the pallida feeds. Pallida is a spoon with that you feed the baby with milk, okay. And the direct, and if it's for direct feeding also, we call the mother in. For phototherapy babies, we call the mothers frequently to feed the baby.
Doctor, what are the things that one needs to keep in mind while taking care of a newborn?
Sepsis is a major concern in NICU. So, hand washing is a major priority in NICU. Even the parents, doctors, staff, whoever gets into the NICU, maybe the lab technician or the X-ray technician, whoever it is, has to wash their hands and enter the NICU. They have to wash their hands from the elbow downwards without their watches or ornaments, anything in their hand. And this washing, there are 7 steps of washing, and it's in each wash area 7 steps are written over there, and they can just follow it. And not only hand washing, while doing procedures for babies like lumbar puncture, intercostal drainage, even ventilation, cubic cystostomy, or any kind of procedures, strict aseptic precautions is taken in NICU.
All right, doctor. So, are there any vaccinations that a newborn baby should be taking?
BCG and hepatitis B is given at birth, and then the next schedule will come at 2 months of life. That is a combination vaccines. That includes DPT. DPT means diphtheria, pertussis and tetanus. Along with it comes the Hib. Hib is called as Haemophilus influenza, with the hepatitis B, and now is the injectable polio vaccine is also there. That's come as a combination vaccine. Along with that, we do need to give the pneumonia vaccine and the rotavirus vaccine. Rotavirus vaccine is given orally. So, after the 2 months, the next would be the 4 months and the 6 months. It goes along with the schedule. Yeah.
Doctor, what are the nutritional needs that an NICU baby needs?
The nutrition of the baby starts from day 1 onwards, depending upon the gestation of the baby. In preterm babies, we start on intravenous fluid, that is 10% dextrose with the multivitamins and trace elements. Along with it is the total parenteral nutrition, which is needed for the neurodevelopmental outcome for the baby. So, total parenteral nutrition includes amino acids and proteins, which is needed for the baby. This TPN, it's called as TPN, total parenteral nutrition is called as TPN. This TPN is given until the baby reaches full feeds by 2 feeds or pallida, and then we gradually taper down on the total parenteral nutrition.
Doctor, is there any take-home message that you would want to give the parents out there?
Okay. Parenthood is the most memorable event in your life. So, parents, both father and mother, should share their responsibility in taking care of the newborn, and as neonatologists, we are always there to guide and advise you.